already using SAA tests in the practice for many years. We used to use the small snap tests, or occasionally we would send them off, but we've been using for many years an acute phase protein test to look at inflammation and infection in horses. We were impressed when the Stablelab was demonstrated to us that it gave a figure, an accurate reading. It was done in 10 minutes, and then we were very impressed with the data on neonatal foals. We have 4 large thoroughbred studs of which we provide work, as well as numerous other sports horse breeders, and we showed them the data on the neonatal foals and the screening of neonatal foals, looking for septic foals, and having discussed it with them, they were very keen to implement, most of our studs were then very keen to implement it as a screening process. So off the back of that we went ahead and started integrating Stablelab into our normal routine work. Yeah, we do. We use it to monitor response because it's nice to see a figure falling. The owners really like it because you have an actual tangible figure to show them, to say that, you know, it was 1,000, now it's 500, now it's 200, and you can track things going down. It also helps with deciding longevity of antibiotic courses and longevity of treatment. If you can see that the SAA is falling rapidly, then you'd feel relatively confident to cease its treatment or start taking it off treatments, whereas if it's remaining at a fairly high level, then you'd be a bit concerned that things weren't clearing up as well as you'd like, and maybe you need to look at alternative options. So we do use it quite a lot to monitor response to treatment and find that effective. I think the top thing for us is that it's horse side. We really find that to be beneficial. We carry them around in our cars, all of our vets carry them around now, and it's most effective for helping us make a decision at the time that you're with the horse. I'd say there's a case that really stood out that made us aware of how useful the machine was. We had a foal last year who was lame, hind limb lameness, who appeared to have a little bit of sheath swelling and a little bit lame behind. We assumed it had pulled something, done the splits in the field, injured itself somehow, but that was one of the yards that had decided to implement routine screening. So we did routine bloods SAA on all of their foals, and that particular foal came up with a very high SAA, which at the time we were slightly dubious about because we couldn't really fathom why this foal had a high SAA, being as it was just lame. As it turned out, the foal developed further swelling in its scrotum and actually had a rhodococcus abscess in its groin, which subsequently was surgically drained and the foal treated. But it definitely highlighted to us that you can use the SAA screen as a means of detecting disease before it's clinically apparent.
It makes a huge difference just being able to decide on the treatment plan with the information to hand while you're with the client. So for cases that aren't hospitalised, deciding whether to leave antibiotics, deciding on whether you need to do further diagnostics there and then, I think it makes a huge difference, a huge time saving in driving to and from the practice, or in clients having to come and pick drugs up if you subsequently decide you need them. But also really client satisfaction with some longer term cases, them being able to see there and then that you are making progress, and to be able to follow that in a way that they can very easily understand with a number, I think is really helpful. Clients have really taken that on board. Foals, we now run the SAA as a routine along with IgG, and again in the same way you want IgG foal side, having the SAA foal side means that you can make decisions about care for that neonate straight away, and our studs expect that now. So I think improving the way we treat our cases really, and some of the more obscure cases giving us additional information to help us know whether we need to do further investigations or whether we whether we can just monitor a case, and definitely offering something to the clients that they can understand, that they can feel confident if they're not necessarily seeing an improvement in their horse following treatment, that you can show them that yes, there isn't, there's a very obvious improvement in the SAA, then they can be reassured by that, and just making sure that we're treating cases appropriately really, especially with where antibiotics are concerned. So I'll usually take a range of blood tubes from the horse or foal and run the SAA there and then to decide whether to come back to practice and run the haematology, biochemistry, etc. We have a lab at the clinic, so then obviously if the Stablelab flags up a problem, then we can come back to the clinic. We might run haematology there and a biochemistry. If the SAA is normal, we might decide further tests aren't indicated.